the best way to clear out your arteries. For good cardiovascular health, your arteries must be clear so blood can flow easily to your heart and other vital systems. Plaque can block vessels and cause severe problems like heart attacks and strokes. Now, what does having clogged arteries do to your heart health? When arteries become clogged, they prevent blood circulation to the heart, causing heart discomfort or angina due to lack of oxygen. If you don't treat artery blockages, they can lead to life-threatening conditions like heart disease or cardiac death. Now that you have a better understanding of artery blockages, we will talk about the role of plaque in artery blockages, how cholesterol adds to artery clogging, and other factors that also play a role. A. The role of plaque in artery blockage. Plaque builds up slowly on the inside walls of arteries. It is a waxy substance comprising cholesterol, fat, calcium, and other particles. Over time, this plaque makes the vessels harder and narrower, which lowers blood flow and raises the risk of heart problems. B. How cholesterol leads to clogged arteries. High amounts of LDL cholesterol, called bad cholesterol, can form plaque in the arteries. It's important to control cholesterol levels through healthy food and way of life to keep arteries from getting blocked. C. Discovering regular things that put people at risk for artery blockages. 1. Age and gender as influencing factors. Older people are more likely to get artery clogs. Men, especially those over 45, are likelier than women to have clogged arteries. 2. How people live and what they eat. A bad diet full of saturated fats, trans fats, and refined sugars can make getting artery clogs more likely. Being overweight, not exercising, and being sedentary are significant factors. 3. Possibilities caused by genes. Some people may be genetically more likely to get artery clots, so they must take precautions. Signs and symptoms of clogged arteries. Finding signs early on can help keep problems from getting worse. The symptoms may be different based on which arteries are affected. Typical indicators of a cardiac ailment may encompass cardiac palpitations, thoracic discomfort, and dyspnea. Elevated blood pressure, increased low-density lipoprotein, LDL, cholesterol levels, and unmanaged diabetes can be early indicators of cardiovascular complications. These problems can be found and fixed quickly with regular checkups and tests. Lifestyle choices like smoking too much, not moving around enough, and wrong food choices can develop into symptoms like a chronic cough, leg pain, and trouble digesting food, which can be signs of underlying arterial problems. Different ways to diagnose and evaluate arteries. Several diagnostic tests and methods are often used to check the health of arteries to see how well blood flows, find blockages, and find cardiovascular risk factors. These tests are only done by trained medical workers, like cardiologists and vascular surgeons. There are 2 ways to do it. A. Non-invasive assessment methods. Non-invasive tests like MRIs, CT scans, and ultrasounds can tell you a lot about the shape and health of the arteries without surgery. These tests are safe, don't hurt, and let doctors make correct diagnoses and keep an eye on the health of your arteries over time. B. Invasive procedures for precise artery examination. Angiography or cardiac catheterization may be required for a clear picture of the coronary arteries. In these treatments, a thin tube called a catheter is put into the arteries so that contrast dye can be injected and any possible blockages can be seen. Now, let's discuss the best ways to keep your arteries healthy. A. Changing to a heart-healthy diet. A healthy meal of fruits, vegetables, whole grains, and lean protein suits your arteries. Arterial blockages are less likely if you eat less salt, saturated and trans fats, and other unhealthy foods. B. Regular exercise and physical practice are essential. Regular exercise, like aerobics and strength training, keeps the arteries healthy, improves blood flow, and strengthens the heart. Aim for 150 minutes of aerobic activity at a moderate level or 75 minutes of intense aerobic exercise each week. C. You are dealing with stress and how it affects the health of your arteries. Stress that lasts for a long time can make arteries swell and plaque build up. Practicing deep breathing, yoga, and other relaxing activities can help lower stress and improve the health of your arteries. D. The importance of getting enough sleep for heart health. Maintaining a consistent sleep routine and obtaining a sufficient duration of 7 to 9 hours of restful sleep per night are crucial factors in promoting arterial health. Insufficient sleep is associated with an elevation in blood pressure levels. Let us look at some natural ways to clean out the arteries. A. The power of foods high in antioxidants. Berry, dark leafy greens, nuts, and other foods high in antioxidants can help lower reactive stress and improve the health of your arteries. Antioxidants get rid of free radicals, which are dangerous molecules that can damage arteries and cause plaque to build up. B. Adding fiber to your diet to keep your arteries healthy. Whole grains, beans, fruits, and other high-fiber foods can help lower cholesterol and keep arteries working well. In particular, soluble fiber helps the body get rid of cholesterol by sticking to it in the gut. C. Herbs and vitamins that are good for cleaning out arteries. Garlic, turmeric, fish oil, and coenzyme Q10 are some herbs and vitamins that may help keep arteries healthy and stop plaque from building up. Before taking new herbs or supplements, you should talk to a medical provider. Drugs and other medical treatments. Statins, antiplatelet drugs, and ACE inhibitors are popular medicines to lower cholesterol, stop blood clots from forming, and keep blood pressure under control. These medicines can help lower the chance of artery blockages and heart problems that can happen afterward. Among them are A. Surgical methods to clear up nasty blockages. Surgical interventions like coronary artery bypass grafting, CABG, may be deemed essential in cases of severe blockages. During these treatments, new pathways are made for blood to flow around the blocked arteries, which restores and improves heart health. B. Angioplasties and stents. Angioplasty and stenting are slightly invasive ways to open blocked or too narrow arteries. The artery is made more comprehensive with a tube, and a stent is often put in to keep the path open and transparent for blood flow. Changes to your lifestyle to clear your arteries. A. The most important thing you can do for your heart health is to stop smoking. Smoking hurts the vessel's lining and speeds up plaque buildup. Giving up smoking is essential for clearing your arteries and maintaining good heart health. B. The harmful effects of drinking too much alcohol. Excessive alcohol consumption has a connection with the development of hypertension, cardiac arrhythmias, and an increased susceptibility to arterial occlusions. Moderate alcohol use, if any, is essential for keeping arteries healthy. C. Managing weight and how it affects artery problems. A healthy weight can be kept by eating well and working out regularly. This can help avoid obesity, high blood pressure, and other conditions leading to artery blockages. If you need to, losing extra weight can make your arteries much healthier. How lowering stress can help heart health. Stress that lasts for a long time can change your body's hormones and cause inflammation and plaque in your arteries. Managing stress is essential in keeping your arteries clear and lowering your risk of heart problems. Stress can be lowered by doing things that make you happy, like mindfulness meditation, deep breathing routines, and hobbies. Regularly using skills to reduce stress is good for your health and the health of your arteries. Yoga and mindfulness meditation can help lower stress, raise heart health, and lower blood pressure. Making these habits a daily part of your life can significantly affect clearing your arteries. Now, here are some treatments that work together to clear out arteries. A. Chiropractic care to keep your heart healthy in general. Chiropractic care can improve heart health by ensuring the spine is in the correct position and improving nerve activity. Talk to a qualified chiropractor who specializes in heart care to get personalized treatment choices. B. Acupuncture and how it might help the health of your arteries. Acupuncture, from traditional Chinese medicine, has been used to improve heart health and blood flow. Acupuncture may help lower inflammation and make arteries work better, according to research. C. The role of massage therapy in enhancing blood circulation. Massage treatments can help the blood flow, lower stress, and loosen up the walls of the arteries. Massages from a licensed therapist regularly help clear out your arteries and keep your heart healthy.